Every year in our state alone, over 8,500 babies are born prematurely.
That's 1 in 8 babies born in Colorado.
Tiny babies are a big problem. We need you to help moms and babies be healthy.
The March of Dimes saves lives every day. Not every baby is born healthy. The March of Dimes is driven to change that. We are waging one of the biggest battles in our history against premature birth, and it affects everyone.
In the last decade, Colorado's premature birth rate increased by 15%.
35% of babies covered under employer health plans were either born too soon or with other health problems.
U.S. employers spent $9 billion on claims related to prematurity and complicated births.
And costs continue through special education and other community needs.
Here are a few more things you need to know about premature birth. Prematurity has grown to become the leading killer of newborn babies. Every year, approximately 450 Colorado babies die before their first birthday, due primarily to prematurity. Preemies are twice as likely to have major birth defects as full-term babies. This means possible brain development delays and physical and intellectual disabilities. It is impossible to measure the human and dollar cost of problems that will last a lifetime. Everyone is touched by the work of the March of Dimes. Healthy babies, babies who need our help, kids, moms, dads, extended family members, health professionals, and business people all benefit from the efforts of our supporters, people like you.
The March of Dimes is a leader in ensuring that moms have access to prenatal care and to all the information they need to make good choices.
Sometimes good choices are not enough to prevent babies from being born too soon.
Serenity was born at 31 weeks, 6 days, so she was 8 weeks premature.
Jordan was born 9 weeks early.
Taylor was born at 27 weeks gestation, which made her 13 weeks premature.
She only weighed 3.5 pounds.
She was born weighing 4 pounds, 1 ounce.
She fit in the palm of her dad's hand, if we could have held her.
She was very, very tiny. Her hands and her feet were tiny.
And the only thing going through my mind was, she is so small, and I don't know how she's ever gonna make it in this world as small as she is.
What I was thinking was, please let me hear her cry.
We did everything by the book. We went to regular doctor visits. I was on prenatal vitamins.
Never in a million years did we ever consider that we wouldn't have anything except for a very typical healthy baby.
It was very difficult leaving Taylor every night to go home. And there was a couple nights where I actually spent the night in the NICU in a rocking chair.
One of the nurses came in and said, "Here, I want you to hold your baby because you need to at least hold her one time." And I knew right then that this might be our only opportunity that we would ever have to hold her.
The first time that we got to hold Serenity was the night that she was born. They gave me about 5 minutes to hold her. And I can remember holding her and saying, please don't make me give this baby back.
It took us a few days until we were able to hold her. And that was where I spent the rest of that summer, is in the NICU holding her every single day.
I definitely knew that I was getting, first of all, the best care possible, which is thanks to the March of Dimes.
We're forever going to be grateful to the March of Dimes. One of the medications that was administered to Jordan was a drug called surfactant, and that helps to jumpstart and mature the lungs as quickly as possible in the case of a baby being born too soon. I learned that that drug was developed in part by the March of Dimes and the research that they do, and that drug literally helped to save her life. If it wasn't for that and some other treatments that were developed in part by the March of Dimes, we don't think that Jordan would be here today.
The March of Dimes works all across Colorado to help moms and babies.
In the past 5 years, we have funded $8.5 million in life-saving programs right here in Colorado.
So much support is needed in our own backyard.
And 88 cents of every dollar goes directly to mission programs.
Every corner of Colorado is supported, and you can see the results firsthand.
This year alone, the March of Dimes has supported nearly $2 million in medical research.
The March of Dimes also funds services that helps moms know what the risks are during their pregnancies, where they can find help, and give them support during their pregnancies.
Healthcare providers in our community benefit from educational programs.
Advocacy programs improve access to care for moms, babies, and kids.
And ensure screening for birth defects and services for babies born with disabilities.
And although we are working to prevent premature birth, unfortunately it still happens. And when it does, the NICU Family Support Program is there to help Colorado families deal with the crisis.
The key ingredient is you. Volunteers, donors, sponsors, event participants, advocates, grant recipients, and all other types of supporters bring the March of Dimes mission to life. When you fund the mission, you are a champion for babies.
We really need your support.
This is a fight we have to win. Now is the time.
It's up to you.
You can make a real difference if you give.
Help Colorado moms and babies be healthy.
The key ingredient is you.
Please fund the mission.
Thank you so much.
Fund the mission. The key ingredient is you.